Mystery illnesses, what are they? What are the 5 mystery illnesses that are being missed that your doctor may be overlooking? And what should you know about that, just in case you're dealing with something that no one's been able to figure out? So last time we talked about Lyme disease, chronic Lyme disease as being a mystery illness. And today we're going to talk about mold-related illness. Those of you who follow us know that the technical term is chronic inflammatory response syndrome, 80% of which is water damage building. So maybe we should call this, water damage building syndrome. In the 80s, the term sick building syndrome was first coined, which was related to chemicals in airtight buildings causing illness, which would fall under chronic inflammatory response syndrome. So sick building syndrome actually is a kind of CIRS, of which water damage building accounts for 80%. So, mystery illnesses, what are these? These are things that involve multiple systems and multiple symptoms. It can be psychological symptoms like anxiety, depression. You almost feel kind of crazy and people think you're kind of crazy. It can be ADHD stuff. My wife, when she got formaldehyde exposure in grad school, actually developed really bad anxiety and focusing issues. She got like ADHD kind of flare. It can be chest pain, shortness of breath, gut issues, body aches and pains, fatigue, chronic fatigue. One of my patients actually described her joints crickling and crackling and popping. It can be lancetating, jabbing, stabbing pain. One interesting thing about water damage building, chronic inflammatory response syndrome, is people get excessive thirst. So they drink a lot of water, but because of issues in their central nervous system, they don't retain it. They pee it out. So they drink a lot and pee, it goes right through them. They pee out. Other people, because of this phenomenon, actually will carry static charges easier and they actually shock themselves or others easier in the wintertime. And sometimes it gets so bad that they actually destroy electronic equipment. So yeah, that sounds kind of weird. It's kind of woo-woo, crazy, are you possessed or whatever? And it's actually chronic inflammatory response syndrome. Each of these, the 5 mystery illnesses we mentioned before, Lyme, mold, mast cell, autoimmune, and then dysautonomia, they have very similar sounds, about 80%, 70%, 80% different, but the nuances are where, the devil's in the details, so to speak. With chronic inflammatory response syndrome, you need a water damage building. So there's an exposure, direct exposure. Could be moving to a new location, moving to a new job. It could be, actually, I had one patient who was really anxious at work all week long. She worked in a dental office. We'd go home, felt better in the evenings, and she just thought it was stress to work. Come to find out there was mold in the office, and when she quit working at that place, she stopped getting anxiety during the week. There's also sometimes be weather-related things. Sometimes people who have this will be more sensitive to humidity in the environment. So when the humidity's up, they feel worse. Or even like storms come through, they get water damage to a house. They don't realize, 6 weeks later, they start feeling sick. And with kids going back to school in the fall, most schools, at least in the Richmond area we're at, have some kind of mold issue in them. So sometimes it's, school starts back up and you think it's because the kids are going to school and the stress, etc. And it's actually the cleanliness of the air quality in the schools themselves. So what are some nuances of chronic inflammatory response syndrome or mold? Well, I mentioned the lancing electrical symptoms, which you sometimes can see with Lyme disease, tick-borne illnesses, but the excessive thirst and as well as the urination are unique for that, and the static shocks are very unique. But you have a lot of those symptoms, and part of the evaluation is looking at what's called a cluster analysis, where you look at 13 different clusters, and you look for someone having 8 symptoms in 8 of those clusters. And again, multiple systems, multiple symptoms. So what's the evaluation for this? Well, the evaluation first is someone who fits in this category, which actually, if you look at all 5 of these together, it's a lot of people. I could say maybe 30 to 50% of the population in our country would fit into one of these 5 categories at any particular time during the year. So that's a lot of people, actually. But initially for mold, you do the cluster analysis, then you do a Marcon's test, which is a nasal swab. You do a VCS test, and labs. And labs help clinch the diagnosis, but without labs, you can be 99.5% sure someone has chronic inflammatory response syndrome. The treatment for this typically is not antibiotics like it is for Lyme, or herbals or biofilm 2 or whatnot, but it tends to be more removing the exposure, assisting the body in detoxification, which is usually binders and lipids. And then after that, rechecking, seeing how the immune system is responding and adding on additional helps to that. The trick with water damage buildings is they can be a setup for all the other ones. They can be a setup for long COVID, which is, I did not mention here, for chronic Lyme or post-Lyme syndrome. They can be a setup for mast cell activation, a setup for dysautonomia, or for autoimmune issues. So even when you see one of these 5 mystery, you got to realize these mystery illnesses many times don't live by themselves. They live together. And if in doubt, think mold. Because why? Because half of all buildings in our country have water damage. So if you or a loved one is dealing with a lot of weird symptoms, multiple different symptoms and different systems in their body, doesn't quite make sense, I would think these 5 things we're talking about, and if you have to pick one of the many to focus on, it would be mold. So my question for you is this: are you dealing with, or do you know someone who's dealing with these kind of things that they found to be mold? I'd be curious if you share here, wherever you're listening to this, like what did it take for them to get their final diagnosis? Because ultimately, people sharing information like this can help speed along the process of figuring out when someone's ill or sick. And then we also on our website have a bunch of resources on this particular mystery illness, and we have some other podcasts we've dedicated to chronic inflammatory response syndrome, which is the technical term for mold-related illness. So next week, we'll be talking about number 3 of our mystery illnesses in our short little end of the week deep dives. If there's one you'd like to deep dive in, please let us know. We respond to what people ask us in this space because our goal is to educate, encourage, and empower. And so hopefully that's what we're doing. Take care. We'll talk to you soon.